So here we are. This is the rotator cuff pain live shockwave class. We are live here at West Chiropractic in Surrey, and my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic. So we're going to be talking today about rotator cuff pain, how we treat rotator cuff pain here, mainly using shockwave therapy. So shockwave therapy is an amazing piece of kit. It's a high intensity sound pressure that essentially helps with rotator cuff pain. So we are going live today across a number of channels. We're live on Facebook, live on Instagram, live on TikTok, and we're also live on YouTube. So many of you will be coming to us from YouTube. You see our channel over there. It has two updates every single week through various content. Most of the content comes from questions that people online ask us about how they can get the most out of their bodies, but also from our clients in our clinics in West Byfleet and Addleston asking us questions, and we simply answer those questions in a short kind of 10-minute format videos. So feel free to head over to there. It's West Chiropractic Surrey on YouTube. So today, as I just wait for a few more people to come on, we celebrated Valentine's Day yesterday. So we thought about doing this class on February the 14th, at 7 p.m. in the evening, but thought there might be quite a few people out for Valentine's Day and celebrating. Not me though. No, I was tucked up in bed nice and early. My wife and I just had a little dinner at home, so it's very nice. So February the 15th, it is Saturday. We've got a break in the Six Nations. We had FA Cup last weekend for football. The mighty Bournemouth roll on, beating Everton, and we're playing Wolves in the next round. So looking forward to that. Anyway, enough about football. We're going to be talking today about rotator cuff. So just waiting for a few more people to jump on. You will know rotator cuff pain when you have it. It's very frustrating. It can be very severe at times as well. So just as we wait a few more people to jump on, we're going to be talking today about shockwave and how it helps with rotator cuff pain. So really, the few things we want to go through today are going to be exactly who shockwave therapy is for, how do you identify exactly what rotator cuff problem you have, who's going to be suitable for shockwave therapy, why ignoring your problem is going to be no good. You need to make sure that you're monitoring your body, monitoring the rotator cuff to ensure that it doesn't get any worse. And then the last thing I've got on my notes here is why age doesn't have to stop you from healing as well. So those are the number of things we'll be going through. So let's start with going through what a rotator cuff is. So let me grab my shoulder model here. So this is a shoulder. So this is the front of the shoulder here. This is the shoulder blade. This is the clavicle, some people call this the collarbone, and then this is the shoulder bone here. This is the humerus, okay? Now, these muscles that you can see running across the top here, these are the rotator cuffs. So you have 4 rotator cuffs, supraspinatus, infraspinatus, teres minor, and then a subscapularis one on here. And all 4 of them do various different things. So some of them will lift the shoulder up to the side like this, so this movement here. Some of them will do this movement, so like things like washing your hair, putting things up in a cupboard. And then some of them do this movement, so internal rotation like this. So putting your hand into a jacket, reaching behind your back, trying to do a bra strap up, ladies. You find that it's really painful doing that. And they tend to get a sharp pain across like deep in the shoulder or across the front of the shoulder or down the front of the arm. Sometimes even getting referred pain actually down the arm into the fingers. It can be severely debilitating. And there's 3 different types of rotator cuff tears. So the most common type we see is a grade 1. So grade 1 rotator cuff tear is where you have a slight tear in the muscle, and it can repair itself with rehab, exercise, treatment, physiotherapy or sports therapy, and of course shockwave. Grade 2 is a more severe tear, and then grade 3 is a complete rip, so a complete rupture of the tendon, which used to require surgery, but now we know with research that actually using conservative therapy, things like shockwave therapy, physiotherapy, sports rehab, rehab exercises can get the shoulder back into a good position, full range of movement, full strength without actually having to have surgery, which is obviously great if you don't want to undergo pretty major surgery for a shoulder reconstruction. So these are the main 2 we'll talk about today are going to be the supraspinatus and the infraspinatus. Those are the main 2 where you have rotator cuff tears, and they run underneath the top of the scapula or shoulder blade here, and they can get trapped in something called shoulder impingement syndrome. The blood supply to these tendons is very, very poor, which means that they take a long time to heal. And also, as we've aged, as we've evolved as humans, We sit for longer, we use iPhones for longer, we're in front of computers for longer. So our shoulders have actually protracted forwards like this. They're not retracted like that. So you can see from the side that if my shoulder rolls forward like that, it's going to put a lot more stress through my rotator cuff. So we really need to make sure that we're getting the body in the best position to essentially take pressure off of those rotator cuff muscles, bringing the shoulder blade back, lets it sit nicely, and make sure it's not getting impinged underneath the shoulder joint through here. Okay, so any questions so far? Drop them in the chat. You should see a chat below. We're using a piece of kit called Restream. So essentially we can track the chat from TikTok, Instagram, Facebook, YouTube, and drop them in the show notes below. So one of my team will be jumping on the chat for you as well. We're going to be putting in some links later on in the chat. So links to come to the clinic. So if you are local, you want to come for a Shockwave taster session, stay to the end. We're giving you a really special offer to come and have a session with one of our team here. And also I'll be dropping in some links as we go through on how you can get copies of my book, some other exercises you can do, and then access to one of our team as well, who can give you more advice on your particular type of rotator cuff issue and how you can help with that. Okay, so a couple of tests you might want to do now are really, really simple. So let's just have a look at your general range of movement at home. So moving the arm like this, if you're getting pain before you get into that 90 degrees, then there's a high likelihood there's going to be something going on with your shoulder. Putting the arm up like this and trying to lean back like that. So if you look at my arm here, I'm trying to rotate the arm back if you're getting pain there as well. And I'm trying to bring the arm the other way. So internal rotation. If you're getting pain in the shoulder joint or any sort of clicking, there's a high likelihood that you may be having some rotator cuff issues as well. So, did you know that over 50% of people over 40 experience some level of rotator cuff degeneration? And for those in sports, manual jobs, or even just doing daily tasks like reaching overhead, that's going to be a huge issue. So a lot of people think that rest and painkillers will solve it, but ultimately they're going to end up with weakened shoulders, more degenerated tendons, and problems that are going to go on for much longer. And you really want to get it when it's right at the start, when it's acute, before it becomes a chronic problem, and then means you don't have. It means you can actually do something about it conservatively rather than having to have surgery. Okay. So let's go through it. What is Shockwave Therapy? So I'm going to grab the Shockwave machine so you guys can see. Okay, so I'm just going to tilt this camera down a little bit here. So this is the Shockwave machine here. I'm just going to pop this on for you. Okay. So essentially it is a piece of kit like this. This is the gun. Been playing GoldenEye a little bit. And ultimately, we can use it for rotator cuff pain. We use it on knee tendons. We use it for Achilles tendonitis, plantar fasciitis, golfer's elbow, tennis elbow. It's a great way to bring a lot of inflammation down in the body. It's a great way to create a lot of inflammation in the body in those areas to bring blood. It creates new blood vessels and brings lots of oxygen, vitamins, minerals, and also takes away a lot of degeneration around those areas. So the toxins, removes those from there. So this is a bit backwards in terms of we're conditioned when we're culturally in the UK to take anti-inflammatories. It's all about anti-inflammatories. But now we're saying we want to be pro-inflammatory. Well, pro-inflammatory is great for a short period of time because inflammation ultimately is a good thing in short doses because it brings a lot of blood and oxygen to those areas. So we have certain settings. You have bar. So the bar there is the pressure. Obviously, the higher the pressure, the more intense it's going to feel. The hertz is like the speed that the gun goes at. So you can hear it here. If I turn it on for you, you can hear it go up. Let me try this one for you. So iliotibial band syndrome. This would be like for a runner's knee. You can hear it going off like a little gun like that. It's quite loud. In this case, there's 4,000 shocks that we've got to get through. But they'll go pretty quickly because you can hear it goes pretty fast. Like that. So it emits a very high intensity sound pressure, much stronger than ultrasound. And it gets very deep into those areas. So this is a radial shockwave machine. It's great for those superficial tendons, but it can go super deep as well. If you're looking for something more like for hip arthritis and problems around bursas, you need something more deep, and that'd be more of a focused shockwave, much more intense and much more deeper going into the areas to bring that inflammation there. So this is amazing for people that have had rotator cuff injuries, tendon injuries for short periods of time, but also long periods of time. We tend to see people with chronic conditions where it's been going on for months, maybe even years, and it's really starting to interrupt their day-to-day patterns. And it can be an amazing way to provide them with something different rather than taking painkillers and surgery. So we always do a taster session. We're going to do a taster session on me in a minute. I'm going to bring Ollie in, who's one of my lead sports rehab specialists here. He's a Shockwave specialist, does all the Shockwave here on our clients, and he's going to talk you through exactly what we should be doing. Okay, so I'm going to go and just get changed quickly. I'm going to take my shirt off so you can see, and we'll get everything ready in the room here. Let's give us 2 seconds, okay? Okay, so we've got Ollie here. Ollie is one of our Shockwave specialists. He uses Shockwave every single day for rotator cuff injuries, knee pain problems, particularly runner's knee, Achilles tendonitis, plantar fasciitis, tennis elbow, golfer's elbow, so lots of things. But he's going to be doing it today on my shoulder, so you get to see him inflict a little bit of pain on me, which I'm sure you're all very excited about. So as with any live videos, anything can happen. So let's just hope it's all okay. But Ollie, do you want to start by a little bit telling us kind of what actually is Shockwave? Like how does it help with rotator cuff pain?
So one of the main benefits of the Shockwave is rotator cuff injuries tend to be to do with the tendons. They don't have a great blood supply, so it can take a long time to heal and recover. So we shoot sound wave into the tendon, helps the body to get lots of new blood to the area, helps with collagen synthesis, so helps to regenerate the cells that make up the tendon. Can desensitize nerve endings as well, so you can often actually get a quick reduction of pain straight from using the Shockwave after the first one, but then it usually takes a protocol of sessions to get the best outcomes.
Amazing, yeah. So you reckon some people even leave after one session feeling a bit looser and less pain?
Yeah, so we will usually do a couple of tests, so say with the shoulder rotator cuff, there's some specific tests we can do. We'll do those before, at the start of the session. We'll use the Shockwave and then we'll test them afterwards and see if there's been a quick improvement. If there is, that's usually quite a good sign that it's worth doing the treatment.
Okay. Amazing, that's great. And you mentioned obviously there's some people that it's not suitable for. So I know in the past you said people who are taking like anticoagulants like warfarin, it's not suitable for them. Why is that?
So blood thinning medications aren't ideal for the Shockwave because of its impact on the blood, the angiogenesis of the creation of new blood vessels. It can lead to bruising, and things like that. So not ideal.
Yeah, that makes sense. So basically, if you're taking an anticoagulant, you need to let us know. It may not be suitable for you. The reason is it's going to obviously create a bit of damage in there. Like you said, create new blood vessels. If the blood is thin, that can obviously create more bruising or problems with circulation. The other one is like if they've had if clients have had this, it's very likely they might have had a steroid injection.
Yeah.
So what's the issue with that? Is there a certain time frame that they can't have the Shockwave in since having a steroid injection?
Yeah, the time frame is usually up to about 12 weeks post-injection. We can't use the Shockwave because it will temporarily weaken the tendon. So there's actually an increased risk of rupture of the tendon. Outside of those 12 weeks, the tendon is more than capable, more than strong enough to tolerate the Shockwave. So not a problem outside of that.
Okay, so 12 weeks, got it, and then you can have the Shockwave after that?
Yes.
Okay, got it, fine. And what about if I've got like a pacemaker in my heart? Can I have it?
That's contraindication, a no-go as well. So generally no.
Okay. Even if I've got like an Achilles problem and I've got a pacemaker, could I have Shockwave?
Good question.
I think it is an absolute contraindication, isn't it?
I'm pretty sure it is.
It's tricky.
Just an absolute, because even if it's lower down, it's going to have a huge impact on the rest of the blood system. So yeah,
fine. And then if I was pregnant? I'm not, but if I was.
No go pregnancy as well.
And what another tricky question you may not know, but if I was breastfeeding, could I have Shockwave?
That is a good question. Don't believe I never used it. I wouldn't use it. I don't think if yeah.
Yeah, I'm not sure about that one as well. Putting Ollie on the spot here, but he's doing very well.
Yeah.
I think, well, we'll have to check this out, but I think if you are breastfeeding, you can, because it's not causing any sort of disruption, but maybe on the tissue, the milk, the lactate milk tissue, I'm not sure, but
sure,
we'll check back on that one.
Yeah. It'd probably be one of those cases where it'd be good if you're still in contact with the midwife to check with them as well. But
Great. I'm only asking questions that I know I'm going to get asked on the live chat. So yeah, I'm just putting Ollie on the spot. Is there anyone else who it's not suitable for, we need to be a bit careful about before doing it?
Yeah, if you've got any metalwork, that sort of thing, it depends on where exactly it is. If it's right over the problem area, then generally can't use it over there as well. Yeah, we've gone over the injections, blood thinning medications, people under the age of 18, so kids, young adults, it's usually recommended not to have it on there.
Okay.
I think any open wounds, cuts, abrasions, any real angry red inflammation, acute injuries as well. So this is usually for more longer term problems.
Yeah.
So it's those sorts of things as well.
Yeah, so if I was out playing cricket or I'd fallen over on my arm, and this was the first time it ever happened, you probably wouldn't prescribe Shockwave as the first port of call. We'd probably try and bring the inflammation down and get the thing moving. But if this had happened, say, 10 years ago and I was a professional cricketer or a village cricketer and I'd had a shoulder injury for 10 years, then Shockwave is probably going to be suitable for me, right?
Yes, yeah, absolutely.
Cool. All right, well, let's get going. Talk us through it, kind of what you're going to do, and yeah, let's have a look.
So we'll do a couple of the tests that we might want to look out for first. So one of them is just getting you to cross your arm over to your left shoulder and then lifting your elbow up towards the ceiling. So generally with people with a rotator cuff issue with the supraspinatus muscle on the top here, this would be a very painful movement. So that will give an indication of maybe where we would want to use the Shockwave across the top of the shoulder here. And then if you were to bring your arm out towards me, so thumb facing up, I'd bring you a little bit further down and here, and just get you to push up towards the ceiling. This is another one that may create pain, be quite difficult for people. So lifting above head is a common complaint. And then if you turn your thumb facing down, this position as well, and then pushing up towards me. So these three are usually quite good ones to use to see, okay, what's the pain like, what sort of range of motion does a person have? Gives an idea, as I said, of where to use it. So we're going to use it across the top. The supraspinatus comes across the top and joins into the upper arm, and we can go either side of this bony spot here. So we're going to use some ultrasound gel. This might be a little bit cold. We go on towards the top of the shoulder here. Okay, and then we start on a lower setting. So with the Shockwave, the higher the pressure, the better. But particularly on the first one, it's a bit of a bizarre feeling. It's good to start low and then work away from there. So I'm going to start at the very bottom with Jeremy. Okay. So the
it's going to get relatively loud now. So what we'll do is we'll do like 30 seconds or so, stop, talk you through exactly what it feels like.
Yeah.
And then we'll go from there, okay?
All right. So, you ready?
Yep.
3, 2, 1. So how's that pressure there?
Yeah, it feels fine. I can definitely feel it. It feels like a very, very, very tiny sort of electric pulse, I guess. But the Shockwave is made up of, there's no electricity, right, going through the body. It's all sound pressure. So it's a very high sound pressure that goes deep into the tendons.
So I might want to turn up the power a little bit more. Okay. How's that there as well?
Yeah, I feel that more, definitely.
Yeah. So Jeremy mentioned it's mainly sound energy, sound pressure. That makes it a little bit different from, you might have heard of things like ultrasound, which use thermal energy. So you have to keep moving the machine around. So it's not too specific, whereas here we can hold it right on the spot. If we're not careful with the pressure, and if we do hold it for too long, then it can bruise the skin. But overall, we can be a lot more specific with the shockwave. We can target right onto the painful, problematic area. Something okay?
Yeah, it feels good. I can definitely feel it working. You can feel it sort of vibrating through the whole shoulder blade.
Yeah.
When it's going through the tendon.
Yeah, so it's going to take a bit of getting used to, but the fact that you can feel it deeper in the tissues, I think that's always a positive sign. Yeah, it's often a common comment I get as well is they don't quite know where the pain is coming from. It feels really deep inside the shoulder. So yeah, it's going to help with getting deeper into there. Take the pause.
Yeah, sure.
Yeah. All right. Great. So there's going to be a little bit of redness that comes around the area. So it's, yeah, often nothing to worry about. Just lots of that blood coming to the area.
Right. So it increases inflammation, right?
Yes, it's pro-inflammatory. Yes.
Okay.
So we want the blood to be there to bring all the healing materials and all the blood to the area. So 24 hours after the shockwave, it's really important not to put any ice on your shoulder or wherever we use it, and to not take anti-inflammatories, things like ibuprofen as well.
Yeah.
As a general rule, painkillers, paracetamol. If you can go without them, then that's definitely best. But if they're really needed, they're okay to take afterwards.
But it's unlikely that I'd need sort of heavy painkillers after a session, right?
Yeah. Hopefully, in the majority of cases, you actually find quite a quick benefit.
Yeah.
So pain levels drop right afterwards. So the chance of needing painkillers is low. Yeah.
Great. Okay. Brilliant. Yeah. Good.
Yeah.
Okay, so that's super important to understand kind of what to do afterwards. So no ice, it's a pro-inflammatory response. So we're always conditioned, I think, especially in the UK, is we need to get anti-inflammatories into the body to reduce the inflammation. So in this case, the inflammation is good because it's bringing blood to the area. So no ice. Also, when you've done it on me before, when you've done it on my Achilles, you've always said don't run for sort of 24 hours afterwards because the tendon's going to be inflamed. If you're running, that's going to create more problems and maybe risk injury. So no running, right?
Yeah, any high impact exercise, try to avoid. Strength training is usually okay to do afterwards. So with your Achilles, like heel raises, that sort of thing.
Yeah.
But just no high impact hopping, jumping, running, that sort of thing. Yeah.
Okay. And like you said, you said maybe after the first session you feel good, but how many sessions do you think I would need, and what should I expect after that course of sessions?
Mm-hmm. The protocols that we use here from all the research is up to about 6 sessions, 1 week apart. That has been found in research and also from experience here of getting the best results.
Yep.
So it might feel good right afterwards. It can take a little bit longer for the healing to really take place. And even after the 6 sessions is finished, the healing, the new blood vessels, the blood coming into the area will carry on helping your shoulder or wherever the problem is to carry on healing.
Great.
Yeah.
Okay, amazing. And if you stay to the end, we'll certainly be going through a link where you can book in for your first session at a discounted rate, so we'll run through that as well. All right, thanks Ollie for that, that's great.
My pleasure.
Okay. So there you have it, a live Shockwave class with the fantastic Ollie. Thank you so much, Ollie, for doing that for us. He's got a wealth of knowledge. We're going to be looking up the breastfeeding question because both of us are a bit bemused by that one. And it's also good to find out, because I know there will be some of you watching that have recently had kids and you are breastfeeding, so we want to make sure that it's safe for you. So we're going to pop a link in the chat now below. You can book yourselves in for your first Shockwave Theta session. If you have any of those things, rotator cuff pain, golfer's elbow, tennis elbow, any knee pain, plantar fasciitis or Achilles tendonitis, then let us have a look, see if we can help you and then get you some relief that you so need. Rather than taking painkillers, rather than waiting for the NHS or NHS physio to help you, why not take the responsibility yourself? Because ultimately, if you don't, then no one will do it for you. If you're not getting better after 3 months of having this pain, I need to tell you, it's not going to get better on its own. You have to do something proactively or get somebody to help you be proactive about it for you. All right, so the link should be coming in now. You can see that in the chat and then you can pop your details in there and get one of the last spots. We've only got special offer for 10 people, unfortunately. So this time round, we obviously do these kind of lives a couple of times a year. But with this entry, we've only got 10 people coming on board. So essentially what will happen is you have your initial assessment, you have a Shockwave taster session, you'll have a full examination diagnosis. It's usually £135. For the first 10 people, we're doing it for £45. And then one of the team can recommend a plan of care for you. Usually the plan of care, if you are suitable for the Shockwave sessions, it's usually once a week for a 6-week period. And we have indicators that we take and go through as we go through the program. Okay. So like I say, ignoring shoulder pain, it doesn't go away on its own. And ultimately it can lead into more problems, arthritic shoulders, frozen shoulders, which can take a lot longer to fix. So it's really important if you are struggling with any of the things that we talked about today, if you're struggling to throw a ball, if you're struggling to run around after your kids, or you're struggling to sleep properly, then this really could be one of the main things that could help you going forwards. So my best advice would be to act on something now before it becomes more of a chronic issue going forwards. We had a client recently, a lady called Sarah, who literally was one of the healthiest people we'd seen. She was very active, very fit. She did a lot of CrossFit, running, lifting weights. And she had a niggle for sort of 3 months and didn't do anything about it, thought it would get better. And ultimately it didn't. And it developed into like a grade 1/2 rotator cuff problem. And she couldn't even sleep on her side, couldn't brush her hair. And after the 6 Shockwave sessions that we prescribed for her, she was able to do press ups again, get back to lifting overhead. You know, by all means, after just 6 weeks, she wasn't lifting 100 kgs, but she was much better, being more active, and she was having a lot more fun as well. Because pain, it can really impact you. So if you are interested, grab that link below. We'll look forward to seeing you in the clinics. We're based in West Byfleet in Addleston. Like I say, we just got 10 spots available. So if you are interested, please get yourself signed up. And if there's any other questions, just give me a shout and I'll look forward to seeing you soon. Thanks for taking a bit of time out on a Saturday evening. I really appreciate it. And we'll see you next time.